Hello, I'm Steve Feldman, president of the Human Animal Bond Research Institute, HABRI for short. Welcome to another important conversation for Pet Week on Capitol Hill. Today's session is brought to us by Mars Pet Care, a leader in helping us care for our pets, but also one of the companies that's really investing heavily in research on human-animal interaction, all the different ways that pets are good for human health. Mars also supports our speaker with some important research that you're going to hear about. Dr. Nancy G. is the director of the Center for Human-Animal Interaction at Virginia Commonwealth University, VCU Health. She's also been a research manager at the Waltham Pet Care Science Institute, which is part of Mars Pet Care, so she has a long and productive relationship with our sponsors today. Dr. G also serves as the chair of the Human Animal Bond Advisory Board for Pet Partners, and she's president of the International Society of Anthrozoology. So she is world-renowned for her work on human-animal interaction research. She's got some important data to share with us today. Please welcome Dr. Nancy G.
Thank you, Steve. Today I'm going to talk about loneliness, social isolation, and companion animals. And first, I'd like to give a little bit of credit to a summit that was sponsored by Mars Pet Care and HABRI, which brought together researchers and practitioners in HAI and aging, pet care industry leaders, representatives of the NIH, and the 19th Surgeon General of the United States. The key topics that were discussed in this summit, first of all, were loneliness as a serious health risk. Even before the pandemic, loneliness was considered to be at epidemic proportions. And in terms of the risk to one's health, it's been equated to smoking 15 cigarettes a day, and it may even be more dangerous than obesity as a public health concern. Another key topic was that the population age distribution is changing. The human population is expected to double by 2050. In Europe, 2 in 10 people are 65 plus currently. In the United States, by 2050, 4 in 10 people are expected to reach the age of 65 plus. We also know that the prevalence of loneliness increases with age. Diminishing social networks, increased occurrence of health problems put older adults at a greater risk of being lonely. Loneliness in non-institutionalized older adults is estimated to be 19.3%. In fact, 43% of all people over the age of 60 report being lonely. A meta-analysis was conducted of 70 research studies representing some 3.4 million participants. And in that study, they found that loneliness among older adults accounts for a 26% higher rate of mortality, even after factoring out covariates like gender, socioeconomic status, physical activity, and smoking. And the situation is even more pronounced among older adults who require inpatient treatment. 75% of older adults who are hospitalized report feeling lonely. The evidence on pet ownership is encouraging, but from a scientific perspective, because people self-select for pet ownership, meaning they want to pick their own pets, we don't really know if pets make them healthier or if healthier people opt to own pets. But the evidence on animal interactions, particularly on dog interactions, is very convincing. So in this slide, each of these bullet points represents one or more studies that have shown this result. So, for example, older adults who interact with an animal, they have decreases in cardiopulmonary, neurohormone, and anxiety measures, decreases in heart rate, muscle tension, and skin temperature, blood pressure, risks of falls and hospitalization rates, depression, fear, mental stress. We also see improvements in things like physical activity, walking distance and speed, walking ability and stability, social behaviors and interactions, mood, activities of daily living, and quality of life. Because of findings like these, we have reason to suspect that a dog interaction may reduce loneliness and impact other health outcomes for older adults. Together with my colleagues at Virginia Commonwealth University, the University of Maryland, Tufts University, we conducted a pilot study to address one fundamental question. Can interacting with a dog reduce loneliness and improve other health-related outcomes in hospitalized older adults? So the current study, the aim of that study, well, first of all, we target our study specifically on the most vulnerable older adult population, those who are admitted to the hospital. In fact, our participants were 60 years or older and scheduled to be admitted to the hospital for at least 5 days. So these were vulnerable individuals. In all cases, our participants were able to provide consent for themselves and were not allergic to or fearful of the dogs. The aim of the study was to assess the efficacy of a therapy dog visitation intervention. This is where a human handler and their dog goes and visits with them and chats with them for a little while. Delivered over 3 consecutive days, and we compared that to a conversational control. In the conversational control condition, we had just the human handler go and talk to the patients, or to treatment as usual. This is our control condition. This is the high standard of care that they receive in the VCU health system. And what we were looking at was loneliness, anxiety, and mood. And our hypotheses for each of those variables pretty much the same. We predicted, based on previous research, that the handler and dog would result in the best changes in loneliness, anxiety, and mood. We thought the handler might also help a bit, but treatment as usual would be the lowest condition. So we expected the dog and handler to do well, the handler only to be kind of somewhere in the middle. So this is what the study looks like. Participants, 42 of them, in fact, 21 male, 21 female, who indicated they were willing to participate, and they passed our inclusion screening criteria. In other words, they're the right age and they're capable of participating in the study. They were then randomly assigned into one of these 3 conditions: treatment as usual, which is what our normal treatment of care, standard of care for patients here; conversational control. This is where the handler shows up and visits with the patient for a period of 20 minutes, or visits from a dogs on call team. This is human handler and their dog, and they go and visit the patient also for 20 minutes. So each of these conditions lasted for 20 minutes per day over 3 consecutive days of their hospitalization. This is what the larger study looked like. On day 1 was the pre-intervention. We took a bunch of measures. On days 2, 3, and 4, that's where the intervention was delivered. And we measured participants before the dog and handler came in and after, or before and after the handler showed up, or before and after they were receiving their standard of care. We did that for 3 days in a row. And then on day 5, we took a number of post-intervention measures. And then what's unique about this study is we're in the process of conducting longitudinal follow-up at 1 month and at 6 months. Our key outcome variable was loneliness, but we also collected data on other variables such as anxiety and mood. For this presentation, I'm going to focus exclusively on that pre-post data during those 3 days for both loneliness, anxiety, and mood. So here are the measures. We took 2 measures of loneliness. These are well recognized in the field as reliable and valid: the UCLA short form loneliness scale, an analog loneliness scale, which is a visual analog scale where they basically put a horizontal line on a bar that ranges from 0 to 100. How lonely are you feeling? It's a basic question. We also administered a mood scale, which is a smiley face assessment where they selected emoticons depicting their current mood state. And then anxiety, we used the state trait anxiety inventory for adults, also a nice standardized measure. So next I want to show you some of the results. I'm going to show you a series of 4 graphs, one for each of these measures that I've just presented. All of these will focus on trajectories of change. What this means is that it doesn't matter where each group starts. What matters is how much it changed from pre to post. What you'll see is that in all cases, the trajectory of change in the dog handler condition was significantly better than treatment as usual. This was not true for the handler only condition. Let's take a look. So here's our first graph. This is the UCLA loneliness measure. As you can see, the magenta colored dashed line represents the dog and handler condition. It has a much steeper slope from pre to post compared to the solid blue line, which is treatment as usual. In other words, loneliness decreased significantly in the dog plus handler condition from pre to post. Although there was some reduction in loneliness in the handler-only condition, this was not significantly different from treatment as usual. Now we have the analog scale of loneliness. This graph is that second measure of loneliness, and it's even more clear than the first graph. As you can see, the dog handler conditions showed a significant reduction in loneliness from pre to post intervention when compared to treatment as usual. Again, the handler-only condition was not significantly from the treatment as usual condition. In fact, it pretty much matched it. This graph is showing our result for anxiety. Here again, you can see that the dog handler condition resulted in a significantly less anxiety from pre to post when compared to treatment as usual. Again, the handler-only condition was not significantly different from treatment as usual. It's also interesting to note that anxiety in the treatment as usual condition actually went up from pre to post, indicating that patients become anxious while they're in the hospital. And finally, we have the smiley face mood scale. Note that in this case, higher scores indicate better mood. So again, as was in the case with the three previous graphs, the trajectory of change in the dog handler condition was significantly different from the treatment as usual condition, meaning that mood was improved in the dog handler condition. Again, handler only was not significantly different from treatment as usual. So trajectories of changes in loneliness, mood, and anxiety showed significant improvements from pre to post in the dog plus handler condition when compared to treatment as usual. This indicates that dog plus handler interaction is effective at improving loneliness, mood, and anxiety in hospitalized older adults. The human handler only visit, in other words, our conversational control, did not result in similar findings. This indicates that there really is something unique and beneficial about the presence of a dog. So why is this study important? Well, this is the gold standard of experimental methodology. It's a randomized clinical trial where participants are randomly assigned to conditions. It uses the highest quality measures, which are both reliable and valid, and the highest standards of ethical considerations for both the humans and the dogs. And importantly, the outcomes indicate that there is something special or unique about the presence of a dog that goes above and beyond the contribution of the human handler in this situation. I'd like to thank Mars Pet Care and their Waltham Pet Care Science Institute for funding this work. I'd also like to thank our partners at Sheltering Arms Institute for allowing us to collect our data there. As always, I'd like to thank our Dogs on Call handlers and their amazing dogs for supporting this research project. To learn more about our program and our ongoing research projects, please visit our website or follow us on social media, and don't hesitate to reach out to me via email. Thank you.
Thank you, Dr. G, for sharing your work with us. I think it was not only were the findings really important, but I think you gave our audience a really nice lesson in how to do high quality research, which I think is also really important.
Thank you.
So let's talk about, I'd love to hear a little bit more about why this study is important and how it advances what we know about human-animal interaction.
Yeah, thanks for asking that question. I did mention that it's kind of the gold standard for research methodology. That's important because it allows us to make causal statements. In other words, we can say that the presence of the dog caused these changes. That's really key. Also, it's important because we used high quality measures and high standards of ethical considerations for both the humans and the dogs. The results show that interacting with a dog is beneficial for vulnerable older adults. These types of interactions involve volunteer handlers and their privately owned dogs, making them a very low cost yet effective solution to these really deleterious effects of loneliness and anxiety. We need this kind of evidence to inform policies and affect societal changes that can increase access to these types of interventions and programs. And this study is a solid beginning, but the reality is we need more research. In particular, we need more funding to support larger scale investigations. Will give us information about generalizability of these findings, more longitudinal studies to examine the durability of these kinds of effects. And we need more information about dosage. How long does that interaction need to be for us to see these beneficial outcomes? And what types of interactions work best for whom?
Well, Dr. G, I appreciate the need for more research. HABRI is all about funding high quality research, and we're so pleased to be funding a different project with you. But with loneliness being so detrimental to human health, with so many people experiencing loneliness, as you so powerfully laid out, what can mental health practitioners, what can human health practitioners do now? How can this research affect practice?
This is a great question. Right now, underway is this pairing of research with practice, and it's something that we're absolutely working on in the field. And this kind of evidence allows practitioners to implement animal-assisted interventions in a way that is beneficial to their practice. For example, our Dogs on Call program here in the hospital, Dogs on Call has been around for 21 years, and it's pretty amazingly integrated into the hospital setting. And patients and staff can call in requests for this kind of a program. But I recognize that we're somewhat unique. And what I would love to see is the opportunity for more people to have access to these kinds of programs, for practitioners to find ways to activate or use these kind of programs in a way that is beneficial to both the humans and the animals. We mustn't leave out the animal welfare side of this. We need to make sure the animals are in fact treated as our partners in the process and not a tool to be used. This is one of the great things about our Dogs on Call program. Animal welfare is at the highest in terms of our priorities. We want to make sure to take care of those animals, because when they're happy and enjoying themselves, that the beneficial outcomes are so much better. The human benefits more, and so does the dog.
Well, I know we're all about data, but since you mentioned the Dogs on Call program, I can't help but ask, especially after we saw those wonderful handler animal teams on the screen. Do you have a favorite story about those animals and visiting folks at VCU? Tell us more about that.
It's really interesting because the field of HAI started out kind of based on anecdotal evidence, and it's because it's so powerful. And I've been witness to some of these experiences firsthand, and it can be sort of chilling to see it happen, in that it just is so amazing when it's happening. For example, one of our Dogs on Call teams went to visit a patient who was in a coma and had been non-responsive for quite some time. And the request was made by a family member who was also in the room. And as the dog was walking down the hallway, you could hear the dog's tags jingling. And when they walked into the room, the family member greeted the dog, was really happy to see the dog. And then the patient moved their hand so that they could touch the dog, and the dog brought their nose right into the patient's hand. This is a person who had been completely non-responsive, and yet they responded to this dog when they weren't even responding to their relatives. They responded to the dog. That's incredibly powerful. And I'll tell you another story, and I don't eat up too much of your time on these because I have so many of them. But I've shadowed some of our Dogs on Call teams. This means that I just kind of follow them as they visit so I can observe them. And I shadowed one of our pediatric teams going to the infusion clinic. This is where children are receiving chemotherapy. And the room is beautifully decorated. It's like a fishbowl. There are fish everywhere. It's absolutely gorgeous to see. But even so, when you walk into the room, there's a heaviness to the room. And there are these chairs where a child is sitting with their parent, and the child is uncomfortable, unhappy, often crying. And the parents are just wearing a weight on their shoulders. And when one of our Dogs on Call teams walked in, it was absolutely amazing to see. There was a child who was just sitting there crying softly, just obviously very upset. And they looked up. She looked up when she saw the dog, and her face brightened, and she actually got up. They're allowed to get up and walk around if they want to. She got up and got on her knees and started just playing with the dog on the floor. And I looked around the room, and there was not a dry eye in the room. The parents were crying, the healthcare workers were crying. It was just amazing to observe a child who was so weak and so decimated by their experience have just that moment of being with that dog and just being if you will, a normal child experiencing a normal child event of just interacting with a dog. Now, I'll tell you, it was very powerful movie experience that I won't ever forget. And it's one of the many reasons why I'm so proud to be the director of this program.
Wow. So I got chills just listening to the story. Pretty amazing. All right, well, let's see if we can bring this home. We were talking about and focused on loneliness. You mentioned the Surgeon General, Dr. Vivek Murthy, and how he's made loneliness an important cause for the Office of the Surgeon General. What can policymakers, what do policymakers and members of Congress really, what do you want them to know?
Yeah, I think you've seen from the background information I presented that loneliness really represents a major mental, physical health challenge for society in general, but for older adults in particular. Research is showing that interacting with a therapy dog has measurable benefits, measurable outcomes. The study that I presented today shows that this is particularly true for vulnerable older adults. We need policies that can help increase our access to these kinds of complementary, low-cost interventions, because they can be important in addressing public health concerns surrounding both loneliness and social isolation. And I also want to put in a plug. We need more research, and to accomplish that, we need more research dollars dedicated to funding this kind of research.
Well, I've really enjoyed this Q&A, and I've learned so much. Just one last question. Is there anything else you'd like our audience to know?
Absolutely. I'd like to invite all members of Congress, and particularly those from Virginia, to visit our Center for Human-Animal Interaction here at Virginia Commonwealth University in Richmond. See for yourself the impact of our Dogs on Call program. And I'd also like to thank the leadership of VCU and VCU Health for their foresight in establishing the Center for Human-Animal Interaction 21 years ago and integrating the Dogs on Call program so seamlessly into the VCU Health hospital system through its sort of far-reaching locations. Dogs on Call visits everywhere, and it is highly impactful. One last little factoid. Dogs on Call is aimed at visiting patients and their families in the hospital, but we did a quality assurance study, and we found that of the people who touch our dogs, 77% of them are healthcare workers. So let's not forget our healthcare workers in all of this. What we're doing is making a difference for them too.
Dr. Nancy G., thank you so much for your leadership, for your important research, and for joining us today and sharing such important and moving information. We hope people will go to the websites that we have on the screen and learn more. And again, we're so glad that you're with us today.
Thank you so much for having me, and thanks to HABRI for funding our other research project as well.
Thanks again to our session sponsor, Mars Pet Care, for bringing us this session, for supporting Dr. G's work, and for being such an important partner for the Human-Animal Bond Research Institute. Thanks also to all of the Pet Week sponsors for making a week of conversations about the human-animal bond possible. I hope you'll stay tuned for our upcoming sessions. You can find all of those at petnight.com and on the HABRI Facebook page. Remember, if you missed something, it'll be on demand after it first airs. Thanks again for watching. We hope to see you soon.